both for having you here. Please, what's your name?
My name is Samuel Dansodebra.
Okay. Please, can you give us a small highlight on what you are presenting about?
So today we've been talking about glaucoma. We're talking about actually OCT, the utility of OCT in glaucoma. We're talking about visual fields and then GDX very soon too.
Okay. So please, what should we be expecting after the end of your presentation?
So I'm hoping that after the presentation, you guys will be able to interpret OCTs. So you'll be able to understand the place and value of OCT and how to interpret the results to add to your clinical decision making.
Can you give us an advice to we the coming doctors, what we have to know in other stuff?
So this is the emerging trend in glaucoma diagnosis and retinal care. So the earlier you got to know it, the better. So make the most out of your this session and then learn how to answer.
Thank you so much for your time.
Hi, and what's your name, please?
Hello, my name is Osukidian. I'm a level 500 student.
Okay, level 500 optometry student, right? So, I'm here to ask you of the purpose of this program.
Okay. So, the purpose for us gathering today is to, get more knowledge when it comes to ocular imaging.
Ocular imaging. Okay, so what are the objectives you have?
So at the end of the program, we are hoping that a greater percentage of us will get practical skills when it comes to the use of the OCT and then explaining the OCT printouts, and also a VFT printout and probably a GDX printout if there is time.
Okay, so after this program, what are the next programs or initiatives you have?
Well, after this program, we have, I think God willing, next week we are starting something called the OSAG-UCC weekly quiz. So there will be quiz questions designed on a flyer, put on the platform, and then the various students in the various classes would answer. If you are the first person to come out with the correct answer, the association would award you. And then also we are looking to start what is called the OSAG Tidbits as well. And then the OSAG case study series. So we take a case and then we all analyze it together in the UCC optometry page. And then with the tidbits, just like how we do the tips for the week, tips for the day, we bring out a tip and then we all, post it on our statuses, create the awareness. That's the upcoming program.
Okay, thank you.
Hello.
Okay, so what's your name, please?
I'm Nathaniel Amoabin, but you can call me Captain.
Okay, your level?
I'm in 500.
Optometry student.
It's my 5th year.
Nice. So, which program are we at?
So, ocular imaging program with the objective of expanding how to assess the ocular assessment of the eye using equipment like OCT, VFT, and then GDX. And it's a very productive program that I'm really glad that the Optometry Student Association of Ghana UCC chapter has brought on board.
Okay, nice. So how is this going to be beneficial to you in your years?
Okay, so it makes it easier for someone like me and my senior colleagues to diagnose a lot of ocular diseases that affect the posterior chamber of the eye, the posterior part of the eye. Glaucoma is rising in Ghana, so with the use of this OCT, VFT, and then the knowledge about it, it helps me know my way about assessing the eye.
Thank you.
Hello.
Your name, please?
My name is Anthony Collins Kwabla, a level 300 optometry student.
How about you?
Yeah, I'm Jonas in team level 300 optometry.
Okay. So, what are the objectives of this program to you?
Alright, so basically we are trying to see, we are talking about ocular imaging and how we can actually apply them in making diagnosis in our clinic.
Yeah, we are here to learn more about the technologies in optometry and then how to use the OCT, VFT.
Nice. So how is this going to be beneficial to you in your clinical use?
All right, so I'm expecting that at the end of the program, if I'm having about 20% knowledge, I should upgrade to about 90% in getting more ideas on how to diagnose diseases, ocular diseases, and then to overcome certain medicological, legal cases that comes with patients, and then the clinicians. Yeah.
How about you?
Yeah, so we are learning so much. So many new things being said here today, and hopefully this serves as a platform from which we can advance and learn more about things related to ocular imaging.
Thank you.
So what's your name?
I'm Rita Yelima Bayem.
Please, I want to know what you learned from the seminar.
Oh, okay. Actually, I learned how to interpret the results of OCT. Basically, that's what I learned.
What's your name?
My name is Dr. Emmanuel Ekwampia.
Look, please, we want to know what you learned from the seminar.
Okay, so this was like a refresher course for me. I already have prior knowledge on OCT and VFT, but I've forgotten some of the stuff. So this was like a refresher course to refresh my mind on some of these things. So basically that, and also I also added more knowledge to what I already know. Yes, so that's what I learned. Yes.
That's very nice. Please, any advice for upcoming doctors?
Okay, so I advise every optometry students to learn hard, pass your exams, and come and join us in this profession.
Thank you so much for your time.
You're welcome.